Okay, hello, my name is Petra Hanson, and I'm an NIHR Clinical Lecturer in Diabetes and Endocrinology. I work clinically currently at Coventry Hospital, and academically, I'm based at Warwick Medical School. I had a bit of a interesting career path because I went to school in Czech Republic, where I'm originally from, and I actually got a scholarship when I was 16 to come to England to study just for like a year exchange. And I ended up staying in England ever since. And I went to Bristol Medical School, and then I have joined the Academic Foundation Training Program in 2012. And very much since then, I have been in the academic clinical training pathway. So after my foundation training, I have done the ACF, which is the Academic Clinical Fellowship, then went and did PhD. And after my PhD finished, I returned to training as a clinical lecturer. And I have been working as a clinical lecturer for the last 3 years. So I'm mainly interested in metabolic medicine. So that will be in the field of type 2 diabetes, obesity, and really anything that comes with metabolic syndrome. I'm also interested in mindfulness, so it's probably a slightly different topic, but actually I'm interested in the application of mindfulness, both for patients, especially living with chronic conditions, and also for healthcare professionals. So I'm looking at understanding how mindfulness can be used in our medical career to improve our balance. And my current projects are looking at mental health, specifically mental health for people living with type 1 diabetes, and how we can use digital tools and various digital products in improving mental health in people living with type 1 diabetes. And I think it stems from my long-term interest in mindfulness and mental health that I mentioned was very much a driver when I was leaving medical school. So what got me interested in mindfulness was when I was in my last year of medical school in Bristol. I went on my elective to Nepal, and they do things very differently. And I learned a lot in there. And they actually do a lot of meditation, and mindfulness was one of the things that I picked up there. And I realized when I started working as a junior doctor, that it's really important to do a little bit of meditation to look after your mental health. And that led me to doing some research in mindfulness. When it comes to metabolic medicine, when I started as F1 in my hospital in Coventry, we have really good research facility. It's called the Human Metabolism Research Unit. And I got introduced to the different things that the facility can do, and really understanding in detail all the different pathways that can contribute to development of metabolic syndrome and obesity. And that fascinated me, so I wanted to do more research in that. And since then, really, all my projects were obesity related, and the more I learn about it, the more I wanted to understand it and do more work in it. I think that it goes hand in hand. It's absolutely linked to everything I do. And actually, I would say the clinical work really mainly informs my research, because when I was working mainly clinically, a lot of the ideas for research was coming from a conversation with my patients. And so that really led to some of my research work, which then fed back into my clinical practice. So for example, when I was doing my PhD, I got to spend a lot of time with my patients. They were coming for essentially 24-hour studies. And I got to do a lot of talking with them in the metabolic unit. And they really inspired me in terms of what to do next in improving care for people living with obesity. And so that led me to doing my current research, which was looking at application of digital technology and digital tools in improving our obesity services. And that resulted in some of the changes. And actually, in my current hospital, we have incorporated digital tools into our specialist obesity services as a standard of care as a result of some of the work I've done. So I think it's essentially a beautiful circle. So it starts with the patient. They identify what is the thing that should be done. I then try to do some research. And then if there is a good evidence behind it, we put it back into clinical practice. So what I love about being clinical lecturer, so I work 50-50. So it should be a split role between research and clinical work. And I think it is, number one, is the flexibility. You have bit more autonomy over your time as a clinical academic. But also that comes with some of the hardship, because you need to sometimes do 2 full-time jobs. So that makes it a bit harder. But the beauty of it is that you can bring new innovations into healthcare. And I think that's a real privilege, because with clinical work, there's a lot of things that are changing all the time. And I love being part of the force that drives the improvement, development in our clinical practices. I think it's very creative work, because not only we get to test things, but actually we, together with patients and other people who work in certain fields, we come up with the new ideas to test. So I think it's extremely creative, inspiring, and fun part of the job. So I think that the first thing would be to really find out why they want to do it, because as I have now realized, doing this for the last 12 years, is that it's really hard work, and you have to be prepared to put the graft in. So you need to make sure that if you really want to do it, you have got your heart set on doing it lifelong, because clinical academia is a lifelong career. Because I think once you have the passion, you will always have the passion, and you work you work nights, you work days, you work your weekends. You can't really put it down. So first thing would be finding out actually why do you want to do it, and if you really have the passion, be prepared to put the hard work in. But on the other hand, also be prepared to have quite a lot of rewarding back. So be prepared to have a lot of positive things from your patients, from your colleagues, and really from your work, seeing your work being used in then day-to-day medicine and changing the way how we do things. I think it's really important to have a really good mentor. So when I started, I was lucky enough to have a lot of people that were senior to me that helped me, and they continue to help me. And I think that on our journey, no matter how senior or junior we are, it's so important to always find out someone that is a mentor, and we can ask questions, and they guide us on our pathway. The other thing I would like to say is that it's absolutely fine to fail. And I think especially with clinical academics, it's getting harder and harder to get things like grants for your research studies. And I've been working hard and getting so many rejections for so many years. And it's really important not to be put off by that, and just to find something in you that just keeps you going back and improves your resilience, because that's the nature of clinical academia. I think you've got about 95% rejections and 5% of successes, really. I've been doing this for the last 12, 13 years, so I still think that I hopefully will have more impact as I go forward. But the 2 areas I think I did have impact is, one was to really bring some innovation into our obesity services. So I had passion for obesity service and for improving ways in obesity service for a very long time now, and I wanted to bring in the digital tools into it. And as I alluded to before, together with my patient, one of the patients from my PhD study, we have worked on this idea and project for many years now. And essentially over time, we managed to co-create a new digital tool that we then introduced into our obesity service. We then evaluated, it had really good outcome. And this year we got a really large NIHR grant to test essentially the digitalizing obesity services in 4 different NHS sites in the UK. So we are looking at Wales, Birmingham, London, and Coventry. And so I feel that this is where hopefully my impact will lie, is that I am making real difference to the way how we deliver care for people living with obesity in this country. And the other side where hopefully I'm making an impact is inspiring more people to take up academic clinical careers. So as part of my role in the ABCD committee, we started a new podcast series. It's called ABCD Inspires. And in that podcast series, I interview various people, and they are inspiring people from the field of diabetes, in terms of the projects and research, what improvement they've done in their life, and what people that maybe haven't had any experience with research can do to start their career in a clinical academia. And I'd like to think that in my last 12 years working in NHS, that I have been inspiring other people to do and work in clinical academia, because I feel really passionate about that. And I've had a lot of junior doctors working with me on projects that then started their pathways either as doing PhDs, or they apply for ACF. So hopefully I will be inspiring more people doing clinical academia. I think there are a lot of misconceptions, but the one that probably annoys me most is when people feel that clinical academics are not working very hard, and they often have their feet up somewhere in the office at university. So that is something that I encounter a lot, because people often don't fully understand what clinical academic does on their days when they are not in an NHS sitting in hospital. And actually, I would say most of the time I work probably double to what a full-time clinician would do. So often when I have a week full of clinical work, I wake up at 5 in the morning to try and do some of my academic work before I go to work in a hospital. So it is very hard not to see people work, but actually I would say clinical academics work really hard, and often in a way that is not seen, because they are not there face to face, but the work continues. So I think that would be one thing that I would like to share with everyone, is actually clinical academics are extremely hardworking, and even though sometimes you might not see them working, we are there. We are doing the writing our manuscripts for grant proposals on Sunday nights and Monday mornings before we go to work. So that would be one thing to say. It's great for women who want to have family as well, and I don't mean it in the negative way, because it involves a lot of work. But I think the nature of the job and the fact that it's been more flexible, I think actually it is perfect for those who also have other responsibilities like childcare responsibilities. So I have had my daughter when I was essentially ST1, so third year working, and I was my first year as an ACF. And I must say that the flexibility of always having a little bit of academic time and then doing my PhD actually worked perfectly for me particularly. And I know everyone is different, but actually I think it is a job that, yes, you have to work really hard, but the slightly better flexibility compared to, let's say, full-time clinical work might work really well for people who want to do something else in their life, because they can structure the time slightly better, maybe because they have got the maneuverability of sometimes 25% of the time, sometimes 50% of the time, and that I really appreciated. And I know that other people, everyone has got different needs and they like to do different things, but that I would say has been really positive for me, and also in a nice way. I'm inspiring now my 10-year-old daughter to be interested in research, and maybe she will be clinical academic one day because she sees me doing that. Another really important aspect that I enjoy about my work is the ability to work with a lot of different type of people. And so in my role now, I often work with people outside of NHS. So this could be people from university, but also people from various charities. And lately I've been working with different industries and companies. And that has been really rewarding. And I think it adds to the variety of things we do, and it makes it really fun. And you learn to speak to people from different settings that, compared to being full-time clinician, sometimes it will be quite difficult to interact actually with people from outside NHS, because we are not used to the way how they work. But I think this job offers you the variety and the opportunity to work with a lot of different stakeholders, which is extremely rewarding. One thing that really helped me on my journey was 2 programs that I joined. One of them was called Topological Fellowship that I have done in 2021, and that really opened my mind in terms of what is possible in terms of digital and using digital in a healthcare situation. And after that, I have joined another program, which is NHS Clinical Entrepreneurship, which is actually really useful for everyone who tries to understand how we can use a collaboration of external companies, industry, and how we can work and collaborate with other partners and it really helped in the process of developing the digital tool we worked on in our service. So I think that those two actually really shaped my career and improved my knowledge, and then led my further research interest in exploring the use of digital tools in healthcare settings, specifically in the field of obesity. I am a real believer that high-quality research is only possible when you involve all the stakeholders, and specifically actually people living with the condition, the patients. And throughout my career so far, I have learned to do PPI, so patient public involvement, and I'm using it more and more, to the point that in my latest study that was funded by NIHR, PPI is the driving force and is the most important part of the research, because I truly believe that people who live with the condition should be the main drivers of where we go with the research, specifically with the work I'm doing at the moment, and looking at how we can improve the weight management services in NHS and using digital technology to deliver totally remote care for patients accessing the specialist services. The first thing that we are doing in the study is getting essentially oversight group from our patient public to drive the study and to be in charge of everything we do in terms of looking at our protocol, looking at essentially all the ways how we try to incorporate these innovations in healthcare. And I find it really rewarding, and I hope that, you know, when someone looks back at my career, they'll be able to see that I have hopefully contributed with development of a really genuine and high quality patient public involvement input into research.